Crohn's disease is an inflammatory bowel disease. This is also called as regional enteritis. Crohn's can affect the entire gastrointestinal tract right from the oral cavity till the anal canal. The ileocolonic region, that is the terminal part of the small intestine and the first part of the colon, are the most common site affected. Some patients can have an exclusive small bowel disease, some can have an exclusive large bowel disease. Crohn's disease is a transmural disease. That is, it affects all the layers of the intestine. Some patients have severe perianal disease in the form of deep anal fissures and fistulas, multiple complicated anal fistulas and abscesses. Crohn's disease has one unique feature. It has skip lesions. That means the intestine is not affected in continuity. There are areas of normal intestine between the affected parts. This is very unique to Crohn's disease. Some patients have extra-intestinal manifestations. The disease can also affect organs other than the intestine, namely the skin, joints, and also the eyes. So these are called extra-intestinal manifestations of Crohn's disease. Most common symptoms are abdominal pain, loose stools, passing blood in stools, and also weight loss. Many of these patients may have symptoms for a few weeks to few months, and sometimes patients, especially from the rural areas, they have symptoms for more than a year or so, and they are often neglected. Crohn's disease is a very debilitating disease. The disease has to be diagnosed and treated appropriately. The disease has a classic remitting and relapsing course. During remission, the patients have minimal or no symptoms, and during relapse, that is flare-ups, the patients have significant symptoms. Anyone who has these symptoms has to get evaluated for Crohn's disease. A thorough clinical history followed by an endoscopy and a colonoscopy and biopsy from the affected lesions is diagnostic of Crohn's disease. The disease is treated with immunosuppressive medications. Generally, we use steroids, azathioprine, and biologics. Steroids are only for remission. Remission is maintained by giving azathioprine and biologics. Treatment of Crohn's disease, especially with the advent of biologics, is very effective. The debilitating nature of the disease can be mitigated by appropriate treatment. Surgery has no role in Crohn's disease. The disease cannot be cured with surgery. Surgery is only meant for complications of Crohn's disease like intestinal obstruction due to stricture or perforation or cancer. Sometimes patients with perianal Crohn's disease may need surgery to drain the abscess before they start biologic treatment. So Crohn's disease, like any other chronic illness, has to be kept under control. It has to be kept under remission by using appropriate treatment. Do not neglect the symptom, do not neglect the disease. With time, the disease only worsens. If you don't take proper treatment, the disease will worsen and you will develop a lot of complications of Crohn's disease. With the advent of biologics, the treatment of Crohn's disease has been revolutionized. Even patients with severe Crohn's disease not responding to other forms of treatment can get biologics. We have something called as a step-down therapy. Patients are first treated with biologics and they later switch to other medications. So all patients with Crohn's disease wherein the most effective treatment, that is a biologic treatment, is started first, or biologics can be taken for the long term. My name is Dr. Dattaram. I am a consultant surgical gastroenterologist and laparoscopic surgeon practicing in Hyderabad. If you like the content, please like, share and subscribe. And if you want to contact us, please call us on 98954 37059.